I'm Dr. Malik. Today we will talk about an important topic, Acanthosis nigricans. Acanthosis nigricans, what is it? Suddenly you notice one of your relatives you have seen after a long time, maybe after 1 year or after 6 months, you have seen him or seen her in some marriage or some function. You recognize that they have the lady or the boy, the lady or the boy or the man, they have picked up some weight. They have become little overweight, and you see black stripes on the neck. You see black skin on the neck. The neck, particularly the neck, the back of the neck, the front of the neck. You see thick black spots or rash. I mean, not exactly rash. The skin over the neck becomes black, and sometimes you see small warts also over that, particularly the area where they wear the jewelry, the neck, the back of the neck, the front of the neck. You see some dark patches. You see some dark patches where skin becomes little rough. This is called the black stripes on the neck. It is Acanthosis nigricans. At the same time, the patient, I mean not the patient, the person who has, the male or the female who has this problem, they must have picked up some weight also. The weight also increases. You can see them little more weight than you have seen previously, and you can see black patches. The skin over the neck is black with sometimes small warts over that. Most of the people think that it is because of jewelry. No, it is not because of the jewelry. The skin becomes dark and little rough, back and front, little rough, and sometimes small warts also will be there. This is called Acanthosis nigricans, and the patient also, the person also picks up weight. So why this happens? This happens because of increased level of insulin in the body, hyperinsulinism. The insulin in the body, the insulin in the blood, the insulin in the body, the pancreas is working like anything. The pancreas is overburdened, and the insulin production has gone to that level that it is hyperinsulinism status. The body has high levels of insulin. The body has high levels of insulin. This is called hyperinsulinism, and it can lead to diabetes. Already the particular person might have got diabetes, or maybe is not aware that he has got diabetes. Hyperinsulinism initially comes with this. When you recognize these black stripes on the neck, that is acanthosis. Already the patient is having hyperinsulinism, high level of insulin flow in the body, but your body is not responding to that particular insulin. You have high insulin, the body is not using that insulin. So this can lead to diabetes. It's a pre-diabetic status, or the patient is already a diabetic. He might not have checked it. So please notice. And another important complication is fatty liver. Once you note this acanthosis, once you have seen this hyperinsulinism and black stripes on the neck, acanthosis, the patient is already having fatty liver. That means what is the work of the main? There are plenty of jobs for the liver, detoxification of food, etc., and digestion by secreting bile, digestion of the food. And number 3, whatever leftover sugar or glucose when we eat, suppose you need 1000 calories, you have eaten 1500 calories. The left of the 500 calories, which is available in the form of glucose or sugar, is taken up by the extra glucose which is there in the intestines, because it is after you eat, the total calories which go to the muscles, brain, body, all used up, and leftover calories, ultimately every food, fat, protein or carbohydrate is converted to glucose. So this particular glucose, which is excess, which is not being used up, is stored by the liver in it by converting the glucose into fat. So This is how the extra sugar, the extra glucose which is there in the blood is converted to fat by the liver, and it stores in it, so that in the when you are fasting, for about 2 to 3 days, you are not eaten anything, this will be released from the liver in the form of glucose again. This fat is converted to glucose again by the liver, and it releases into the bloodstream to save during starving periods. So fatty liver, also hyperinsulinism, diabetes, and fatty liver is another important complication. Fatty liver, again, grade 1, grade 2, grade 3, and again after grade 3, naturally the liver undergoes fibrosis. And ultimately cirrhosis of liver is the last complication. The liver totally get damaged. So grade 1 fatty liver, grade 2 fatty liver, grade 3 fatty liver, and ultimately fibrosis of liver and cirrhosis of liver is the last complication. So one more, we call all these things, hyperinsulinism, diabetes, fatty liver, high BP levels. Your BP will be high, and you may develop hypothyroidism also. Hypothyroidism is another complication. All these things put together, we call them as metabolic syndrome. So this metabolic syndrome is already existing. When you see this acanthosis, this is black stripes on the neck. So very, very important. At that time, what are all the investigations you advise your friend? Number 1, HbA1c, we all know that it is the glycosylated hemoglobin. HbA1c is the test for sugar. Number 2, ultrasound abdomen. You ask your friend to undergo a scanning of the abdomen, so that to know liver, how much liver is damaged, how much fatty liver is there. And number 3, thyroid profile, T3, T4, TSH. These 3 tests you must undergo to know whether the patient is a hypothyroid or not. And lastly, CT angiogram. Why CT angiogram? Because you have so many complications already in the body. You must know how much is the supply to the heart, the blood supply to the heart, how much it is hampered. There are 3 vessels which are supplying the heart. Are there any small obstacles in it? So you must undergo a CT angiogram, which is a small test. It is not a routine angiogram. It is called CT angiogram. After a small injection of contrast, they will 15 minutes CT scan will be done, and they will tell you how are your blood vessels which are taking blood to the heart. So 3 blood vessels, how they are they in a good condition, or they are blocked? Already there are blockages in it. You will know it. CT angiogram is a must, because with all these complications, they are likely to develop a heart attacks and all. So please, CT angiogram is a must. So how to reverse this problem? Once you reach this problem, you reach this hyperinsulinism, how are you going to reverse it? Most of the people, they come to us sir, write some cream for this black spots and all. It is simply melaleumin depigmenting cream. We write for that, but that is not the treatment. This is only symptom treatment. That black neck spots, no, you can treat with melaleumin depigmenting cream, but that is not the treatment. Treatment is, first important thing is, the reason behind this is you are not doing proper exercise, you are not taking proper food, you are not doing proper exercise, and you are not doing the treatment comes here. Exercise 20%, food, diet 80%. 80% lies in your diet problem, and 20% is exercise. Daily routine, in your daily routine, you must include 80% you must concentrate on the diet, 20% you must concentrate on the exercise. Exercise regularly, walking or cycling. Cycling means I prefer cycle indoor, that is exerciser cycle. So one day you do walking or cycling, that is cycling at home, that is inside your room, exerciser cycle, half an hour to 45 minutes. The other day you do some push-ups and pull-ups, total body exercise. One day walking or cycling, the other day You do like this. One day this, for example, Monday you have done cycling or walking. Tuesday you are going to do dips and push-ups, pull-ups and push-ups. Simple. So dips and we call it. No? So the only thing is push-ups and pull-ups. Simply. So some sit-ups and some push-ups. These are all the things for half an hour to 45 minutes. Total body exercise. One day you are going to do cycling or walking. Other day you are doing push-ups and pull-ups. These are the things you have to do. Sit-ups, something like that. So at least round total body exercise for at least for half an hour to 45 minutes a day, and 80% diet. So what are all the things you are supposed to change in the diet? Change the diet which is, see, high, what do you call is, you have to go for the diet which gets slowly converted to glucose. The diet which gets slowly converted to glucose. Okay. So the thing is, please try to avoid 5 things. 5 things you have to avoid. Rice you must avoid in whatever form it is. Wheat you must avoid. You must avoid rice. You must avoid wheat. You must avoid sugar. You must avoid jaggery. That is yes, which comes from sugarcane. Jaggery which comes from sugarcane, and maida. Maida also you must avoid. These 5 things, if you can avoid at least for some time, for 6 months to 1 year, you will definitely improve. And what are avoiding things? Rice, wheat, sugar, jaggery from sugarcane, and one more thing is maida. These 5 things are dangerous. First stop them and turn to millets. The best thing is, try to have more vegetable salads. And some low sugar containing fruits, like vegetables, normal vegetables, any number of vegetable salads, and at least 1 or 2 fruits you must have daily. So that is also low glycemic index fruits, like guava. You can take all these things. No? So don't take high glucose containing fruits, high fructose containing fruits. So please, vegetable salads are 30% of your diet. 30% of your diet should be vegetable salads. And number 2, most important is millets. There are 5 types of millets. Because why millets? Because they are low glycemic index. Definitely millets are low glycemic index. They can get converted to glucose very slowly. So rice, wheat, all these things are high glycemic index. So please take low glycemic index foods like millets. So one time you please take at least millets. Lunch, please try to take millets. And dinner, it is better to have something like quinoa, which is high protein, very good protein, and which is also low glycemic index food. So please concentrate on your diet. You have to change the diet. You have to reduce your weight. Everything is reversible. All the things are reversible. Your diabetes is reversible. Your hypertension is reversible. Your black stripes, all these things are reversible. You have to reduce weight. Slowly, not drastically. You have to reduce. So change in the diet is very important. Exercise and change in the diet. These are the 2 things which you have to do as urgently as possible. So diet, especially diet, 30% should be your raw vegetables, uncooked vegetables if possible. Fruits, 1 or 2 fruits per day. Low glycemic index fruits. And one more thing is millets. You have to replace rice and wheat with millets. There are 5 types of millets. And one more thing is, dinner better have quinoa. Quinoa is the best. Quinoa is also low glycemic index food, very good in protein, very rich in good protein, very good protein. So try to do all these things. So first, try to avoid this particular problem. This is nothing but you are slowly going to complications. You are slowly going into a metabolic syndrome, and ultimately you will be landing in coronary heart disease. Ultimately you are landing in heart attacks. So CT angiogram is a must. And most importantly, you have to change your lifestyle and food, particularly food. 80% depends on your food, 20% depends on